And when you're looking for your unknown primary, do you have a system as far as, I do ipsilateral tonsil first, and then I move on to, base of tongue? Or, let's say you're going in and you really have no preoperative hints as to where it might be. How do you kind of start that search?
I always start with the tonsil. 60% of the time, it's going to be there. If they've had a tonsillectomy, obviously it makes it a lot easier. You start with the tongue base. And one of the things that has changed my practice was that meta-analysis I referred to before that essentially noted that the risk of the contralateral tongue base having the primary, so contralateral to the neck node, is only 3%. I just didn't feel like it was worth the risk of causing, even though you're taking a small amount of tissue, there's pretty good data in the sleep literature to show that even a lingual tonsil does cause some dysphagia permanently.
So do you do ipsilateral tonsil, ipsilateral tongue base, contralateral tonsil?
No. The chance of it being in the contralateral tonsils is near 0%.
They don't
Very
need to
unlikely.
match. You don't need to have.
I don't match them. I know the patients. They always ask, "You're not going to just take them both out?" Like, I'm not doing that.
Got it. Okay. So with that, so basically that kind of sets your limit as far as, if we're looking for it, we're gonna remove the ipsilateral tonsil, we're gonna remove the ipsilateral lingual tonsil, and that's it. And if it's not there, then we kind of move on to it's going to stay in the kind of unknown primary category, but we're not going to add morbidity searching for it on the other side of the base of tongue.
Yeah, that's exactly right. We're going to try and maximize therapeutics and minimize morbidity, and that's now where we are at.
Yeah.
And we haven't had any unknown primaries recur to date. We've been quite remarkably fortunate, but at the same time, it's the disease. You're talking about small volume disease, and with appropriate treatment and adjuvant therapy, you're still talking about greater than 90% cure rates.
Yeah. Just because of the disease itself, right? It's very different than our other, like squamous cell carcinoma in the head and neck.
Yes.